Good day, everyone. I just want to thank the organizers for inviting me to this conference. And maybe I should thank Manuel as well for the fantastic introduction. You're probably asking yourself, what is Coca-Cola doing at this conference? So let me place things in context. Home-based care, home-based testing, and ART within communities. So more context on that. Within Mozambique, we have 44,000 active outlets scattered all around the country. Within the Coca-Cola system, there is over 5 million active customers scattered around the world. In over 200 countries around the world, the Coca-Cola system is present, and also the global supply chain that Coca-Cola has. So that's the context of why I am here today. What has happened in Mozambique is to look at how to get access to critical medicines to everyone. And before I continue, the model case that Manuel mentioned about Beira, that in fact is our model case. That is a self-sustaining operation that we've introduced. They do all their planning, they do all their forecasting, they do all their deliveries. It is done entirely by the DPM in that area. So with a success rate of 96%, so it can work. So let's tap into the private sector, or what the private sector can offer for HIV treatment. Access to critical medicines. It's an African donor priority. Donors and other civil organizations have done fantastic work on reducing the prices of critical medicines and making them available to African governments. However, the issue is, once they land within the country, once they land on the continent, what happens to it then? And this is where the issue comes in of how do you treat if you don't have access to these medicines, if you don't have access to the test kits. If it's sitting somewhere in a warehouse at the port, it serves no value. And as the clock ticks, people are dying. When compared to the private sector, the local public sector, unfortunately, is not very good at supply chain, especially in Africa. And again, if you looked at the previous slides and previous presentation, there is a huge need for ARVs in Africa. So the private sector and civil society have started realizing that in order to improve this, in order to get the medication to where it's needed, the private sector needs to be involved. They need to be approached. They are within country in many countries. And what happened in 2011, Coca-Cola Mozambique was approached by CHAI, and we signed a memorandum of understanding. It was a 3-year memorandum of understanding, and with the intention of developing a strategy, and a sustainable strategy. The strategy is not that Coca-Cola will forever in eternity run the delivery operation, but in a phased approach start transferring that capability to the government officials. Ultimately, that's where policy is made. And one of the outcomes that we looked at is how do we present tangible numbers that you can present to governments and give them the confidence that this can work. So why the Coca-Cola system from a partner perspective? You will all agree the Coca-Cola system has an unparalleled reach and consumer connection. It also has a global and local initiative and expertise. So strength lies within the global system, but also within different countries and on different continents there is strength and the expertise and the infrastructure especially. The footprint across the world is huge, and it's growing. There's institutional knowledge, working with different institutions, educational institutions. For example, as we speak now, the project work that we've been doing in Tanzania and in Ghana and in Mozambique is now being an academic paper. It will be written soon by Yale University. Also, we're working with Georgia Tech University, as you know, in Atlanta, which is the home base of Coca-Cola. So once these academic research papers come out, it now becomes a model that you can start replicating around the world. And again, you can engage the local employees within the operations. Even more positively is the convening power that the system has in terms of negotiating preferential rates. And one of the key successes to our model in Mozambique is leveraging this power that we have to negotiate better rates for the system. And we've generated substantial savings, and one of the key criteria for these savings is that it needs to be plowed back into the healthcare system. For example, I'll give you an example. Over the last 2 years, we've generated close to $1 million in savings just in supply chain. And this money has been plowed back into the ministry, who has procured more ambulance. So you have more ambulance, you can get more people to the testing facilities. They've also looking at procuring more test kits. So it now becomes a sustainable system, and with all the pressures around the world in terms of cost, this is a self-funding system that can going forward. So to save lives, what does Coca-Cola do really well? We call it route to market. In simple terms, we can get it to where you want it. There's an outlet somewhere in a rural community. There's one case of Coca-Cola there, but you find no ARV. Why is that? So take the opportunity to take the Coke there and to take the ARV and other medication as well. Supply chain processes, very technical. It's part of our core business. Performance management. Part of the strategy going forward is to actually get a performance management system. Just to get back to the Beira operation, the forecast comes from each of the clinical centers. They give a forecast in. Each of the nurses and doctors in that center get measured by their forecast accuracy. They get measured by the obsolescence within that warehouse. They get measured by the number of patients that they treat. So we've introduced a performance management system, and we've helped the DPM to do that. And what this means, it creates accountability. And once there's accountability, people take ownership. When there's ownership, it becomes sustainable. And as I said before, forecasting. It was mentioned in a few other presentations, especially from a supply chain perspective and a global network. In the past, you have lots of obsolescence within the countries. And if you have a proper forecasting system, this helps better planning. How do you reach the 28 or the 36 million that will be on ARV by 2025? You need to have proper forecasting. That 36 million might not only be in Africa, it might be scattered around the world. So without the proper forecasting, it's impossible to achieve. And then also in terms of mentoring and support, and this is how we introduce sustainability. So for sustainable communities, there needs to be partnership. It needs to be innovative. The current problem facing many of the governments is poor capacity and capability within governments. These are the policy makers. So if it's not working on the top level, it cannot filter down. So the solution is a powerful coalition between government, civil society, and the private sector. And right now, within most of the operations, the private sector is involved, but withdrawn from where the actual operation is. So you might have the donors working in the US, and let's say in Swaziland the actual operation is happening. So the capabilities and the strength lies there, but it's removed from where it's needed. So with a footprint of over 200 countries in the world, I think the answer is self-explanatory. And then, as I mentioned before, with the academic approach, you can actually start leveraging the opportunity to replicate. So, from Mozambique, very straightforward. There was a problem, and what have we done? Expired medication, medication not reaching the intended point, and poor supply chain control. We've developed a distribution network. It is one of our core capabilities, and we've utilized that to develop it through SHI, and this strategy has been presented to the government. So how do we position this project globally? We set it within the context. We are responding to an African need. I'm speaking now about Mozambique. And the rationale for our support was a partnership with a memorandum of understanding. So we've signed an initial 3-year partnership. It comes up for renewal now in July, and we've taken a phased approach. So let me share some success stories. Annually, more than 2,000 cubic meters of ARV medication is distributed within Mozambique. And there's a territory of 800,000 square kilometers. Included with that, there's also plumpy nut, labs, and kits that are also being distributed. Monthly, between 700,000 and 800,000 patients in 8 districts now receive regular access to the correct medication. Previously, medication was arriving there, but it might not have been the correct medication. So we leverage our strength as a global power, as a global system, to negotiate with our transporters. So it's not something that we do outside of our operation. All we do is we are the middleman, we negotiate, we make sure that things happen, and we start teaching, we start transferring knowledge. So phase 1 is now completed. Phase 2, we'll start with developing a cold chain strategy and going with direct access to the 800 or so healthcare centers across the country. Remember, 44,000 points of sale that we have in the country. And then also in terms of DBS as well, this is also under discussion where we can actually move that around the country. So in terms of long-term sustainability, the knowledge needs to be transferred. And again, we've already started introducing the performance management system to the Ministry of Health. We're currently working with Accenture. We have just drafted a proposal to the Ministry of Health, which after 8 years of battling, they've actually agreed to and they've signed off. So in the context of the partnership, it's a relationship going forward. And this is what we need to emphasize. It is not something that is, you go in there for a quick win. You have to build a relationship. The 3 points, the government, civil society, and private, we need to recognize that. We're also working with, from a global perspective, one of my colleagues interacts directly with Atlanta. And his sole focus is to develop a system where we can roll this out globally. So, picture says 1,000 words. So really what we have done is we have 2 particular routes where we use our own vehicles. It is such a pleasure for our employees to be involved in this. We actually have, to give you an example, we have one driver who says, I work for you 3 weeks of the month, and in that 1 week, I work for Chai. And he says that. He said, you don't phone me, I'm busy doing deliveries, and I'm taking orders, and I'm making sure that I'm helping people. Okay. And as you can see on the second photo, we also look at warehouse management practices. And this is part of the sustainability. We negotiate transporters, and this is how we will ensure that there's no real investment from our side other than time. But the results are huge. So this is just an example of one particular area. So in our monthly plan that we have, just in the one area, over 160 cubic meters of ARVs. This gets delivered over a 6-month period. Plumpy nut, without treatment without nutrition, actually is not that good. Because you have a little child who hasn't eaten for 3 or 4 days, or even a week. Just the body can't cope with it. So the other examples that I spoke about, work has been done in Tanzania in working with the central medical stores, and Accenture has also done some work on performance management system. At the same time in Ghana, with the Bill and Melinda Gates Foundation, working on cold chain. This is just the start of what could be a successful partnership globally. Thank you.